A 50-year-old man presented to our center after an episode of atrial fibrillation brought on by vomiting induced by a dose of Ozempic. He wanted to know our opinion and get our advice as to the next steps to take. In what situation could the treatment be the primary disease? Welcome to Montgomery Heart Wellness, and we have an interesting situation with a 50-year-old patient who presented to our center. He had a bout of nausea and vomiting, and subsequent to that, he had atrial fibrillation. Now, he had taken a dose or two of Ozempic, and shortly after that, he had nausea and vomiting that sent him to the emergency room, and they found him in atrial fibrillation. And so I remember us discussing this situation before, and the issue then, when it initially came, was, what you would do with the Eliquis.
Right.
Can you share more about this patient and how we started, what led?
The patient also had a history of diabetes, obesity, high blood pressure, high cholesterol, everything. Ozempic being GLP-1 agonist, it can slow gastric emptying, cause nausea, and he vomited a lot to the point he was so dehydrated he had to be hospitalized. He went into atrial fibrillation. Of course, the hospital put him on the standard medications, rate control like a beta blocker and Eliquis for reducing risk of strokes. But he wanted to know, do I have to take this Eliquis for the rest of my life?
So the issue is, does this individual need to be on long-term anticoagulation? We didn't have the tracings, and so we couldn't confirm whether it was truly atrial fibrillation or not, but if we were to assume that it truly was, what we know is that it was the first episode. He had never reported a history of it, and it came after an acute event of volume depletion, probably electrolyte abnormalities, etc. So it's clearly a reversible condition. And so that oftentimes in medicine, you have to make judgment calls. I mean, there's a standard protocol for treating someone with atrial fibrillation, rate control, anticoagulation. I did a whole video on treating atrial fibrillation. However, you don't always use a cookbook approach to patients. Every patient is different, every situation is different, and sometimes those differences are so great, the usual cookbook approach doesn't apply. And I think our discussion last time was that it didn't apply here. So we felt comfortable taking them off the Eliquis at the very beginning. So our initial approach when he came, we discontinued the Eliquis. And then we continued with the workup and started a treatment plan. So what were the next steps after that?
So he got on the meal plan and did the nutritional detox. During the 4 weeks that he detoxed, he lost weight, and I was able to reduce his medications a lot. So I stopped 2 blood pressure medicines, reduced another 1. We stopped the cholesterol medication and atorvastatin. We stopped the diabetes medicine, glipizide, and reduced the dose of another diabetes medication. He was doing great. His blood pressures and blood sugars kept coming down even as we were getting on less medicines. Then we did a reassessment. We repeated some blood work to check some things as well.
Yeah. And the meal plan you described, and for many who are not familiar with our approach, we use nutrition in a very precise way. And we have a series of meal plans that are prescribed based on our food classification system. And so he was on one of those meal plans that was in the detox range, lower food level 0 to 3 or 0 to 4B. And so we make adjustments in these meal plans according to the amount of rapid healing we need. We make adjustments based on how sick the person is. We can also make adjustments in the food selection based on a patient's preference. So the meal plan, as we point out, is literally a food prescription. And we work with our nutritional team, our culinary team. We have an on-site restaurant and grocery store that helps us in manipulating these excellent diets for precisely the needs of our patients. So he underwent that approach. And as you so well pointed out, we were able to rapidly reduce a lot of these medications.
Okay.
What period of time was this again?
That was 4 weeks. During that time, some of the improvements in the blood work, his A1C dropped a lot, especially in 1 month. You know, it was 10.6 to start, which is very high, and it went down to 7.5.
Okay, now we have a lot of people in the audience who are savvy medical people, and they're not going to let you get away with that comment because A1C, as we know, is an average of 3 months.
Right.
But there's something else that affects A1C as well, which is fluctuation in blood sugar. And we have seen, actually we published, in fact, we were the first to publish a significant reduction of A1C in just 4 weeks, of about 3.4% on average in the population we looked at. And these were non-diabetics. So he's a diabetic. So non-diabetics who actually were pre-diabetics that had an A1C thought of around 5.8 or 5.9, so they were pre-diabetics, but we're still able to show a 3.4% reduction, statistically significant reduction in A1C in that population. But this individual, who's a diabetic, had a very large drop in his A1C. But what we did is we reduced the fluctuation in blood sugar with a more controlled and healthier nutritional regimen. And so that's why we're able to reduce it so fast. Did we restrict fruits in this diet or not?
I told him to avoid the higher glycemic fruits. So like, you know, melons, pineapple, grapes, those type of things. So stick more with the berries, apples, citrus, that kind of thing.
Do you have any smoothies or cold pressed juices?
Well, he did afterwards, actually. So after the 4 weeks, I followed up with him again. He did a juicing for a week and his sugar stood fine, which was wonderful.
Good.
And that was greens and fruits. Another thing I was really happy to see was his kidney function improved a lot in that 4 weeks. So the filtration rate of the kidneys, it's one way we look at kidney function. He had been at a 50, which is stage 3 chronic kidney disease. And so a 50-year-old man, filtration rate of the 50, well, our healthy patients who are 50, their filtration rate's still in the 90s. So I really wanted that to go up, and it went up to 63. And I think part of that is stopping one of his medicines, which is a diuretic and can dehydrate you. And then also taking away animal protein, we know is beneficial to kidney function. And then the blood pressure, blood sugar, just everything really helped that get better.
And it's important to point out, as you did, the particular blood pressure medicine called chlorthalidone, which is a diuretic that's used as an antihypertensive. And oftentimes individuals who are having their blood pressure treated are treated with a diuretic as one of the antihypertensives, and it could be working against you, certainly making kidney function worse. And worsening kidney flow can actually be increasing the blood pressure paradoxically. Clearly a situation, this individual was treated with Ozempic, which caused nausea and vomiting, which made him dehydrated, electrolyte depleted, but put him in atrial fibrillation. And then, so clearly a situation where, the treatment, in his case, was at least one of the primary diseases. Yeah, and so by weaning medications, the patient gets better, but you have to start with a healthy lifestyle. First nutrition, and then other things, and then that gets you off to the races. Another case where at the beginning there's a lack of hope and lots of despair, but it turns around with just simple first steps. So we want to help you make those first steps to optimal health. So I hope you got a lot out of this, and we want to hear your comments and show suggestions. Leave them in the comment box. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next